Hi, Dr. Masa at Ace Chiropractic Clinic. I'm going to tell you today about our fertility acupuncture treatment with Japanese style acupuncture. We have a good result with fertility treatment. I have been helping more than 35 female who want to have a baby, ages 27 to 50 years old. They become a mother. Some of them are treated by Japanese style acupuncture and chiropractic only. Some of them are help with medical fertility treatment. So, our uniqueness is Japanese style acupuncture. Japanese style acupuncture is a little bit different from traditional Chinese medicine because we developed our own style of acupuncture needles with insertion tubes, and we have a different philosophy, and we are a very gentle way to stimulate the human body to back normal function. So I will show you a difference between Chinese style or Korean style and then Japanese style. Okay? These are typical packages of acupuncture needles. This side, right side, is Chinese. You can see the Chinese languages, and here is made in China. Okay? And this left side is Japanese acupuncture needles. You can see some Japanese language here, and it said made in Japan. So what the difference is, design of the needles. These are typical Chinese acupuncture needles. The uniqueness of the design of Chinese acupuncture needle is the end of the handle. It's a little bit unique shape, and then we can identify when the acupuncturist twists the needles, easily notice which direction the needle is twisting. Okay, every single one of them, same design of the end of the needles. But needle size is a lot of different. So there is a couple of different sizes, gauges, means diameter and the lengths are different. But basically the Chinese needles are bigger, longer, and then the tip is a little bit rough. So most of the time patients feel little pain when the acupuncturist insert the needles. Not bad, but little bit. The Japanese style needles, there are no such kind of design for the end of the needles. And the needle itself, of course, we have a different lengths, different diameters, but Japanese acupuncture needle is thinner, very fine, and then the tip is also fine. That's why less pain and gentle. And this is a modern type of Japanese acupuncture needles with insertion tube, and this is a disposable. So handle is made by plastic, and then needle itself is very fine. Japanese style acupuncture is a little bit different between Japanese and traditional Chinese medicine. We develop our way to check patient conditions, even though we keep the same principles and fundamental theories. However, we are more palpate, touching the patient and check the energy flows and the pulse, ab check, tongue check, and then skin tone, moisture, color of the face. Then we decide which meridian is too much energy, which meridian is too less energy. So therefore, sometimes foreign practitioners call Japanese acupuncture as meridian acupuncture. So first, we check the patient's skin colors, tones, moisture, then check tongue, okay? Then check the pulse. 6 point. Again, we check the which meridian is too much energy, which meridian is too little energy. Light touch, deep touch. Okay. Japanese style acupuncture needles, we use insertion tube or some called guide tube. It's help to reduce the pain when acupuncture needle is inserted. So always wipe the skin with alcohol cotton. Then before insert the needles, we always palpate acupuncture point areas. Then stabilization hand, put an insertion tube on it, tapping, and insert needle like this. So it's a perfectly perpendicular and not too deep penetration. Again, palpate, stabilization hand, tapping, insert the needles, palpating, stabilization hand, tapping, like this. We do not penetrate too much. We do not twist and insert the needles. The Chinese acupuncturists do not using insertion tube. They hold the needles and then stabilization hand and prick the needles. So it's a different technique of insert the needles. The Japanese style is less pain and gentle. Even though we did not do too much stimulation, but we can see the skin color, the area of acupuncture is inserted, turn to little red. It's a good sign the body react to the stimulation. We try to adjust the energy flows. So usually keep 15 to 20 minutes. Just set as an acupuncture needle like this. Then we take out the needles. Always hold the skin like this and a little bit pull and take off the needles. So this way, the Japanese style acupuncture patient feel less discomfort. If we do just hold the needles and pull, the skin also pull, and this makes a little discomfort for sensitive patient. So we do not this direction. We do hold the skin and a little bit pull, then take off the needles. This is a Japanese style. And always we wipe the skin with alcohol cotton after acupuncture also. And then you can see red colors as a good reaction. Even though stimulation is gentle, the body reacts. Check the patient back and palpate is also very important with Japanese acupuncture. Then move to insert the needles where the acupuncturist pick the acupuncture point which is necessary and work for correct energy imbalance condition. Always use alcohol cotton to wipe. Acupuncture treatment is not cookbook style treatment. So we do not treat symptom. We care the patient. So therefore, what acupuncture point we use for the specific patient is differ. It depends on patient energy imbalances. So that means we do not use same acupuncture point for all female patient who has problem with pregnant. This is the last one for the back side of acupuncture treatment. Japanese style acupuncture, the philosophy is if we received or achieved a same good result, it is much better we use less amount or number of needles, because even though the treatment purpose, the acupuncture means insert iron acupuncture needle into human body. It's an invasive stimulation. So therefore, less invasive stimulation and the good results, it's better less number of the needle using. So if we can use only single one needle to get a same good result, that is the best. So the Japanese philosophy, we try to reduce the acupuncture needle numbers, but we try to keep same good result. So that's why choosing acupuncture point for the patient is very important. Today, I put a little bit big number of the needles, but when the patient condition is getting better, I will use less number of the needles for next session. That is a Japanese style. When we set an acupuncture needle like this, use infrared heated lamp, helping blood circulation and also muscle relax and simply warm up the body. It's very relaxing. Most of the patients fall asleep. Also, we use heated pad for the foot, because when give the heat to the foot, it's very helping to heat it up the bodies. So I recommend you to do foot bath at home, or take a warm bath, not a shower, because shower makes you clean but not warm up your body. So warm up your body is good things. Alright, 15 minutes. I'm going to take off needles. Okay, hold, pick up, hold, pick up, hold, pick up. This way, patient feel less pain. And after acupuncture treatment, not always, but sometimes the Japanese style acupuncturist give a little bit massage, like a gentle palpation. Like this. This also help reduce discomfort and more muscle relaxations. And close the gown for the privacy. There are a couple different points of uniqueness of Japanese style acupuncture. First one is needle. Japanese style acupuncture needle is fine, thin, little, short, and the tip of the needle is good qualities. So it makes big difference, less pain and gentle stimulation. Second one is before the acupuncture needle insert. Japanese style acupuncturist touching the acupuncture point area like a little massage and prepare the needles. This technique also reduces the pain and more gentle. And next one is insertion techniques. Japanese style acupuncture use insertion tube. So this tube gives the pressure to the skin, and acupuncturist tapping the end of the needles and insert the needle. So more comfortable, gentle, but less pain with insertion tube. The next one is handling needle technique. The Chinese acupuncturist using a little bit more aggressively stimulate and try to control ki or chi, the energies. The Japanese acupuncturist using less stimulation to the needles, so therefore patient feel less pain and less discomfort and comfortable. And also we use more touching for diagnosis and treatment, and that also make patient relax and for the better results. I'm not saying Chinese style and Japanese style, one is better than another, but you will feel a different. So generally I'm saying is Japanese style is less pain, gentle and comfort. So you can easily try Japanese style acupuncture. I highly recommend it. Thank you for watching. Bye now.